Have you experienced a fall recently? Maybe you've had a couple more trips and falls or even little stumbles where you have trouble saving yourself recently, and that's never happened before. I'm Dr. Adam Barnard. I'm a physical therapist. I'm a clinic director here at Balanced Physical Therapy in PRUNEDALE, and I'm here to tell you that falls are not normal. A lot of times I'll meet patients and they chuckle when they tell me, oh, I fall here and there. Yeah, it happens all the time. And luckily they haven't fractured anything or struck their head yet, but I want to tell you that you should not begin to normalize this. You should start seeing a professional such as myself if you want to prevent yourself from falling more and more severe throughout your life. Now, the body receives its positional sense from 3 different systems in your body, and I call it the eyes, the ears, and the feet. Really what that is, your visual, your vestibular, and your somatosensory systems. The body combines all that sensory information into one so we can tell where our limbs are in space. Now, a common one that people might say is they had a fall during the evening when they were using the restroom in the middle of the night. Usually the home is dark and they'll trip over something and then fall. That would mean that our eyes can't work as well, and someone like me would uptrain your other 2 systems, your vestibular and your somatosensory systems, to pick up the slack of what the eyes aren't doing as well anymore. Now, another thing could be your vestibular system. That's located in your inner ear, and it provides positional awareness or positional sense of your head in space, and your body uses that information with your eyes to tell you where your head is. And a lot of times we may experience vertiginous symptoms like vertigo when you feel like you're spinning or you feel like you're on your side when your eyes are telling you that you're straight up and down. When the information between your eyes and your ears doesn't match up in your cerebellum, that's perceived as a dizziness like that. We're on a ship or something like that. Someone like myself also has interventions in order to fix the vertiginous symptoms. Last one that we see are somatosensory deficits. So sensory deficits in your feet. Can't feel your feet as well. Now this can be a number of different things. Most commonly what I see is secondary to diabetes, where you have a diabetic neuropathy. Decreased sensation in the feet means the sensation isn't getting sent up to your brain as effectively. Your body doesn't know where your feet are unless it's looking at them. So somebody like me will increase blood flow through resistance training, try to get the total body blood flow going more, and we'll also practice using your eyes and your ears to tell you where you are in space so you don't have to look down at your feet as you're moving through life. Now, of note, another thing that could be leading to falls could just be muscular weakness. So say we're sitting too frequently. When we sit a lot, this becomes tight and this becomes weak. So we want these to be strong, our gluteus maximus. It's a direct indicator of survivability. So if your glutes go, you're gonna be sitting more and you're not gonna be getting outside where life is. So we have exercises to strengthen the glutes. The muscles on the side, your gluteus medius, they're very important for standing on one leg. And you might say, why do I need to stand on one leg? Well, each leg, as it progresses through the gait cycle, it spends 60% of that time standing on one leg and 40% of the time swinging in the air. So you need single leg stability in order to ambulate properly. Now we have exercises such as a hip abduction, a single leg balance in order to improve those muscles. And we'll send you home with those as well. Another one that I see is the hip flexors, those muscles in the front right there. These ones lift your knee up to your chest. You might say, why are those important? But you might also be stubbing your toe more frequently or catching your foot on things or not being able to clear a step, and that would be weakness in the anterior muscles right here, your hip flexors. Now someone like me, a physical therapist, is an expert in neuromusculoskeletal conditions, and we can, through an examination, determine which of those are most affecting you or at what intensity each of them are affecting your stability. Now, if you see somebody like me, we're going to assess it, we're going to give you exercises to work on, and we're going to be with you every step of the way to make sure that you stop falling, because that is not normal. Now, if you'd like to know more, you can find us on Instagram at BalancePTMove, or you can always find us online at balancept.com. Thanks. We'll see you in the clinic.